So my lit paper was over using like non-farm interventions to treat post-op pain or even chronic pain. Because a lot of times when people have chronic pain, they're going to need to have some surgery eventually to correct it. The reason I chose this topic was just, I feel like in nursing school, I've learned a lot about how there's just such a high rate of addictive med addictions, especially opioids, and that's a very common medication to give in for post-op and chronic pain. So specifically my paper was about, how do we treat people with complementary treatments with the addition of pain medication, because I don't know if you could really treat someone just with like non-farm interventions without using some type of med. But just how with using these types of therapies you can lessen the use of addictive medications. Yeah, because even just what we learned in mental health is that addiction is really, it's a disease of the mind, and a lot of times people with chronic pain don't go out purposely to get addicted to these medications. They're using them to relieve something and unintentionally get addicted, and that's something that's really hard to break. So for my lit paper, I used 3 systematic reviews, and across the board, they looked at a lot of different therapies, whether that was acupuncture, aromatherapy, massage, different, I think it was called like shadow boxing, music therapy. So just even in 3 different reviews, there was a lot of different treatments used. But across the board, acupuncture and acupressure were the most consistent to relieve post-op or chronic pain. And some studies did better than others of explaining why that was, or showing, what the pain was before the treatment and then after. But the next most effective therapy was listening, like music therapy, which kind of surprised me just because I guess for me it makes sense, like acupuncture, like you're, putting needles at different points in the body to essentially relieve pain, whereas music therapy, you're just sitting there listening to music. But one article did a really nice job of just saying how a lot of times it's more so connected with anxiety, and how when anxiety levels are high, oftentimes pain levels are higher too. So just controlling and lowering that anxiety has shown to decrease pain, which is really, really cool. The other therapies had a lot more mixed results, like massage with meditation and aromatherapy were just very inconsistent in their effectiveness. But I think that something we need to consider is that just like pain medications, you use different dosages and different types of pain medication for different types of pain. We just need to treat these complementary pain relievers in the same way that they might treat different types of pain. One article did a really, really nice job of just going through each of these different alternative treatments and showing how, like, aromatherapy did a really good job of treating migraines, but not so much chronic pain, versus acupuncture helped with post-op pain, but maybe not these other types of pain. So it's just something to consider, and more research is needed on just looking at different types of pain and how different types of non-farm interventions can treat those.